Hello again, everyone. My name is Marty Guthmiller, CEO at Orange City Area Health System. Welcome to another edition of Insights. Today, we are joined by Amy Van Gorp. Amy, thank you for being with us this morning.
No problem.
Amy is one of our 2 clinical pharmacists who serve the clinic as well as the hospital and outpatient areas and any place else where we need help in our pharmacy coverage. One thing that maybe you might not understand is that Orange City Area Health System actually has 3 different kinds of pharmacists or pharmacies. Of course, the retail pharmacy, the inpatient or hospital pharmacy, and then your area specialty, which we're going to talk about more. Amy is joined by our other clinical pharmacist, Randy Sales. And, quite honestly, Amy started this whole thing, a few years ago and came in and talked to me about it. And I wasn't convinced actually that we needed 1 clinical pharmacist. And now we have 2, and I would have 3 before I had 0 now again. So congratulations on that. And also thank you for bringing that. It's a great service that we're going to learn more about today.
Good.
All right. So welcome again. And could you tell us a little bit about what a clinical pharmacist is?
Sure. So clinical pharmacy, just like in the name, our focus is the clinic or outpatient setting. So we do go to other areas, the hospital, the nursing home, but really outpatient is our focus. And it's when we're choosing medicine for the patient, the start of it, the start of choosing a medicine. So we help the providers pick the best one for our patients. So we're always thinking about the 3 things I always think of is safety, efficacy, how well it works, and cost. So we're always looking at those things and trying to find the best meds for our patients.
It's really interesting to me, the thing, I might have guessed on the efficacy. I might have guessed on some of those other things in terms of helping, but I initially wasn't aware of the cost thing. And let's talk about that right now. I mean, how do you help people address the cost issue, and why is that important?
It's so important because you might have a medicine that is very effective, maybe, and really very safe. And if you can't afford it, our patients won't take it.
Doesn't matter.
It doesn't matter. So we have to address that, and we have to make sure it's something they can afford. And sometimes we have to compromise and pick one that they're going to be able to afford. So what we do is we try to find what their insurance will cover the best. We look through formularies, and we also explore coupons from manufacturers. And
I was going to say, with a name like Van Gorp, you got to at least be part Dutch. And
it's true.
And Dutch involves coupons.
It does.
Right?
Yes.
And in this case, coupons is very much part of what we're doing.
Yeah, it is. So, we do that, and even try to look into some assistance programs too.
Great. Yes, like you said, if people can't afford the drugs, it doesn't matter how good they are.
Right.
Okay, so how is clinical pharmacy integrated in with some of our services here? Primary care, behavioral health, those kinds of things.
So our system is so helpful that the same people are following our people from clinic to ER to hospital to nursing home, and we follow right along with all those paths. So we see people in clinic to talk through medicines, counsel, that kind of stuff, and then we advise in the ER sometimes if there's medication issues, and then if they're admitted, we look at meds when they go home. Their discharge meds, we look through those, and we do monthly med reviews in the nursing home. So we're very involved, I think, in all those areas.
Truly a value added kind of thing.
Yeah.
Can you talk about a little bit what a typical day might look like?
Sure. A large part of our day is dealing with blood thinners or anticoagulation. So we see patients on warfarin or Coumadin, and we do blood testing and help adjust dose. And then also work with surgery, actually, for people who have procedures, and help them figure out when to stop blood thinners. So we get a lot of questions on that. And then otherwise, the rest of the day is filled with questions and med management, and people who get started on medicines, we will help monitor and follow up on those and make sure it's going well.
Good. So you do meet with people
Mhm.
one-on-one, right?
Mm-hmm.
And how does that connection made? Is it made through a physician or provider calling you? Can somebody call you directly? How is that connection made?
I'd say typically it comes from the doctor asking us to meet with someone, but it doesn't have to. I do get calls from people in the community just asking for med review, look through their meds, help them out with something. Are there cheaper alternatives? You know, we often do that. But yeah, a lot of times I think it comes from doctor and just, yeah, helping to
One
get
of the
one.
things you just talked about was a med review
Mm-hmm.
under the Medicare. And, in the past, that may not have been done
Mm-hmm.
or was done at the expense of the physician or provider doing something else, right?
Mm-hmm.
And so one of the things, again, that has been kind of lifted the curtain to me is you actually take workload off of some of our primary care physicians so they can continue to
Mm-hmm.
do other things.
Yeah.
And you pick that up as really a specialist in that area.
Sure. Yeah. I think so. I think that's how we can be used really effectively is
Yeah.
doctor diagnoses and then we can help pick medicine and monitor and freeing them up a little bit until
Good.
they need to come back for follow-up with them. Mm-hmm.
So I know your day just goes from A to Z swimmingly
Right.
and just perfectly every day.
Right.
But if you could think of some challenges that
Mm-hmm.
might happen during your day,
Sure.
what might they be?
Sure. I do think cost comes up a lot. I think we run into roadblocks with insurance and coverage. So I think that comes up a lot.
Mm-hmm.
And then, yeah, I think depending on the type of people we see that day in the ER, if there's things going on, then that gets added in and is kind of urgent. So that will kind of push other things to the back. But yeah, people, getting a new medicine like an inhaler and not really knowing how to use it,
Mm-hmm.
and if they're here and getting started on a new inhaler, we can take them and show them how to use that before they even go pick it up.
That education piece is a key piece, and one of the things, in addition to that type of education, that I know you and Randy offer are meeting with hospital discharges
Mm-hmm.
in terms of understanding the drug that they're taking home, understanding how to use it, because if they don't know those things,
Mm-hmm.
it doesn't do any
Yeah.
good, right?
Right. And, I think a lot of times we will look at their med list, and if we see issues, we're going to try to address it
In
before they even
advance.
go home. But I actually think it's even more helpful sometimes once they are home and then we follow up.
Oh, sure.
Because when they're here, I think it's just hard. Sometimes there's so much information.
Everything flying at
Yeah.
you. Good. So how do people access you? What's
Mm-hmm.
the best way to get a hold of you?
Yeah.
Because I'm sure after watching this video, the phone's going to ring off the hook, right?
You can call the clinic.
Okay.
Yep. And just ask to speak to one of the clinical pharmacists, or you can go through your doctor team.
All right.
My chart messaging, all of that.
Perfect.
Yeah.
737-2000
You got it.
is our clinic. All
Yes.
right. Anything else that you'd like to add from a clinical pharmacist perspective?
I think just know we're whatever questions we're getting from patients or providers, if we get multiple of the same kind of questions, we're gonna address that and maybe give education to patients and providers on that, or bring it to like a clinic staff meeting and educate. So we're always kind of hearing what's going on or what's the big issues and trying to stay on top of those.
Education, I would say, in a word, education is one of the greatest things that you bring to our organization. And, I have the chance to watch and observe and things like that. And I'm always kind of impressed on a physician's ability to maintain the knowledge base of drugs. But that's your area, that's your knowledge. And the way you educate and help the physicians do their thing better is a real resource and really raises the depth of medicine provided. So we really appreciate you and Randy doing that. And thank you for joining us today.
No problem.
Thank you.